Good morning, everyone. This is Melody Pazalt from the Healthcare Authority in the Division of Behavioral Health and Recovery. We'll get started in just a few more minutes, just kind of doing a sound check and doing a little housekeeping on the GoToWebinar controls. So if you're not familiar with GoToWebinar and want to ask questions, we do encourage folks to use the phone, and on your GoToWebinar menu, there is an audio option that allows you to dial in, and oftentimes we hear better if you want to ask questions verbally if you're able to dial in. Sometimes we do get feedback on audio on computer microphones, and so we do encourage folks to, if you want to ask questions, to be able to dial in using your phone. We'll get started in just another minute or two as folks are logging into the system. So welcome to our Criminal Justice and Behavioral Health Interface webinar series. Good morning, everyone. Welcome to our Criminal Justice and Behavioral Health Interface webinar series. I'm just going to do a little housekeeping this morning on GoToWebinar platform, if you're not familiar with GoToWebinar. We do encourage, if you want to ask questions, that you, on your audio pane, call in using the dial-in information for GoToWebinar that should be associated on your menu. Just also to let folks know that this webinar is being recorded, and we are working on getting all of our webinars posted to a website on the Healthcare Authority. This is our 6th or 7th webinar that we've been doing. So we've had our first webinar in January, the sequential intercept model, and then in February we did an overview of prosecutorial diversion programs. We also did a webinar on law enforcement assisted diversion, and we did a webinar on the co-responder program and the True Blood contempt fine projects. Last month was offender reentry community safety program, and we'll get that recording also included on this list. So if anyone's interested in these previous webinars, feel free to shoot me an email, and I will be happy to get you send you the links to those recorded webinars. Today's webinar will also be recorded, and we have already uploaded a copy of the PowerPoint presentation in the handout section on the GoToWebinar menu. So there's some links actually to our previous webinars. And then again, if you're not familiar with GoToWebinar, you have this little handy dandy menu. You can expand or retract your menu by clicking on the little orange button. Again, we really encourage on the audio part of your menu to choose the telephone and dial in. You'll be, once you click on the telephone option, then you'll be provided the phone number as well as the PIN code. And so everyone currently is muted. And so another way to ask questions is to raise your hand. You click the little hand icon, and that raises and lowers the flag, raises and lowers your hand. Also, if you want to ask questions, you can type your questions into the question box, and we'll be, Mark and Melissa will be answering questions at the end of the presentation. Again, this is just a little bit of an overview of how to click on your hands. So now to get started, let me introduce Mark and Melissa from the Healthcare Authority. So glad to have you guys today doing this presentation. Thank you guys so much for sharing how community providers can be a part of the Medicaid suspension program and helping people get reconnected. So I will turn it over to you guys.
Thank you so much. Good morning. My name is Melissa Rivera. I am a Medicaid Eligibility and Policy Manager with the Division of Medicaid Eligibility and Community Support here at Healthcare Authority.
And I am Mark Westenhaver, a Medicaid Eligibility and Policy Manager as well.
Today, we will be providing you an overview of our community-based training to become a volunteer assister and how it relates to ensuring individuals have healthcare coverage who are in and out of incarceration. Want to go to the next slide? So some things we are going to focus is on the background and overview of Medicaid suspension, some of the enrollment options, which is the difference between a volunteer assister and navigator, basics of Medicaid and how that looks in Provider 1. We also will have some suggested recommendations and finally some informational resources for you to take away. Next slide. So background and overview. Next slide. So the idea of suspending healthcare coverage while incarcerated or institutionalized is nothing new, and some states have been already doing this for a while. The proposed policies and implementation plan of Substitute Senate Bill 6430 is the result of 3 work groups with over 60 stakeholders, and we started the Medicaid suspension process in 2017. Next slide. Medicaid suspension is the act of limiting coverage while an individual is incarcerated or institutionalized. And by doing this, it can assist with continuity of care planning and coordination prior to the individual's release. We have a web page dedicated on Medicaid suspension that you can visit by clicking the link here, or you can go to www.hca.wa.gov, and in the search box, just type in Medicaid suspension. Next slide. This is the Washington Administration Code that authorizes jail facilities to apply for incarcerated individuals who may not have health care while they are incarcerated. This can assist with treatment planning for the individual if needed prior to and after they are released into the community. Next slide. So when an individual is incarcerated, the goal is that if the individual does not have coverage, Apple Health can be activated and coverage suspended. Once there is a date scheduled for release, care coordination planning can be done before the individual is released out into the community. So when an individual is incarcerated and has Apple Health coverage active, suspension of their coverage will occur automatically. So that way planning and care coordination can be done prior to their release into the community. So this is kind of like a strategy that we think would be a nice goal for our facilities. Next slide. So now we're going to talk about some enrollment options for your facility. Next slide. So individuals who are uninsured can apply for healthcare coverage. You can do this online at www.wa.healthplanfinder.org. That's the website where individuals who are 19 to 64 years old that can apply for coverage. This process can be done as quick as 15 to 20 minutes, and you will get real-time eligibility results. So before, you had to fill out a paper application and mail it or fax it and then wait for a determination to be made. Where doing it online, it will give you results in a matter of minutes. Next slide. So to determine what is best for your facility, you may decide, do you know who in your community enrolls people for Apple Health, such as Navigators, their in-person assisters, or there are some local DSHS offices that do that as well. Sometimes you need to ask, do you have a rapport set up where you can actually call when you have an individual who's incarcerated and verify if that individual has healthcare coverage active, and if you find that talking to the individual, you're not able to get that information. Another thing that you would want to consider is if your own facility has staff available who can take online training that we have here at Healthcare Authority to become a volunteer assister to do your own enrollment process and inquiries. We have some facilities who have started the suspension process have found that it's helpful for them to have discussions on what resources they have available in their community to create some sort of sustainable process. And so that might mean working with local partners to do that enrollment or assist with screening and prioritization. For facilities who have the staff available to enroll individuals, we have an online training available where you can become a certified Healthcare Authority volunteer assister that we will discuss next. But for the impacted individual, this would be a quick and automatic reinstatement of coverage that would assist in making needed services available the day of release, as opposed to having to wait for a new application to be completed. So next slide. So volunteer assister program. Next slide. So if your facility finds that you have staff or staff members who can become a certified healthcare volunteer assister, we have a link here that you can click on, and it will give you more information about the process. There are, I want to say, 7 training modules that you would need to take prior to the to finishing the course. So you can send us an email that's listed here. If you have, once you have completed it, you would have to also do like a knowledge test just to make sure you understood the modules that you take. It would also include you having to fill out and pass a background check. And then once you complete it, you would be able to start having access to the Washington Health Plan Finder as an assister. Next slide. So once the training has been completed as a volunteer assister, you as a community partner would be able to contact the email address that we have here. And like I said, a test would be done. And so the application will also include registering on a form that we have for the Washington State Patrol to do a background check. And then you would also need to fill out a health benefit exchange user agreement form. Next slide. When you do become a volunteer assister, and then when you finally are able to assist a client to apply for coverage, you will be able to partner with that individual and view their application in the Health Plan Finder system. They have a dashboard, and you'll be able to view it up to 30 days. So when you're partnering with them, it will allow you as an assister to help the client. Let's say if they had to report changes, or they needed to upload a document, or just helping them to extend their coverage if they need to. After 30 days, the information would drop off, but you can always re-partner with the client if needed. Next slide. Healthcare Authority does have designated regionally located staff that can help with the enrollment process for your facility upon booking or prior to discharge, especially since this will be all new. You can reach out to us via email, and then we could provide you a phone number to call based on the area of your facility. So if you find that you do not have the resources available, or to do your own enrollment process, or you would like to know more about how to get started, reach out to us and we'd be more than happy to assist. When talking to facilities that have been doing this already, some questions that they found that was helpful for them to consider that helped guided their facility was, if you do decide that you have somebody that can enroll an individual, how would that look like? Would it be at initial intake? Would it be prior to the individual being released out into the community? Who would do the enrollment? Would it be a correction staff, a hospital staff? And would this be cost effective? We understand that each facility has their own needs and their own operation processes. So, some questions for you to consider would help you assist in deciding on what's best for your staff. So, for an example, do you have initially targeted high need inmates that have severe chronic or complex physical conditions? Are they going to be reliant on medical technology that requires specialized treatment or equipment? Do you have inmates that are with substance use disorders, or multiple prescriptions, or those that are pregnant? So some of the treatment that incarcerated individuals may need could be what helps you decide how soon they should be enrolled in healthcare coverage as soon as they are released into the community. Next slide. So Navigators. Next slide. So if your facility...
Melissa, some folks are saying that they've lost audio. We just want to make sure if folks could raise their hand if you are hearing us okay. You may want to choose the dial-in option on the audio pane to click on the telephone and call in, because I've not heard. I'm hearing Melissa okay, but I am getting a few things in the chat box. So if folks could raise your hand if you're hearing us okay, that would be great. I've got 26 hands, 30, yeah, a lot of hands raised saying that they're hearing us okay. Thank you so much for raising your hand. So Melissa, I'll turn it back over to you to continue.
Okay.
Thanks.
Perfect. Okay, so talking about Navigators, if your facility determines that you do not have the staffing available to become a volunteer assister for enrollment for Apple Health, there are Navigators available throughout the state who can assist you with the enrollment process. Some things we believe that is helpful to keep in mind are the tasks that we have listed here. So again, we understand each facility has their own needs and operation processes, and some of the treatment that incarcerated individuals may need could be what helps you decide on how soon they should be enrolled in healthcare coverage as soon as they are released. Next slide. So by going to www.wahealthplanfinder.org, this is the page that you will see. And so next to the guy where it says virtual help, if you click on that, it will take you to a page with a list of helpful options for enrollment and where you will see more information on Navigators. So Navigators can help with enrollment and answer any general questions you have about the individual's health insurance options or the application process. So help from a navigator is free for people of any with income of income level. So next slide. So we do have a link here that if you wanted to just go directly to search for a navigator nearby your facility, you can find a navigator if you happen to know the organization they are from, or if you happen to know their name. You can also choose a preferred language, or just by entering a zip code, it will give you a list of all the navigators listed near your facility. Intakes can be done by telephone, and it has always been an option prior to the COVID-19 challenges we face today. Next slide. So now we're going to just give an overview of Medicaid. Next slide. So just a little background on Washington Apple Health. Healthcare Authority is the single state agency for the policy and purchasing of all Apple Health programs in Washington state. So for the purposes of eligibility, Apple Health, we divide it into two categories. We will usually talk about classic Medicaid programs that where we work with Department of Social and Health Services, and then we have the MAGI-based medical programs. Next slide. So we have many Apple Health programs, but to be eligible for a MAGI-based Apple Health for Adults program, the individual must be age 19 to 64, have an annual household income that is, at or below the Medicaid standard, be a U.S. citizen or meet the immigration requirements, and not be entitled to Medicare. Most individuals are going to go through the Washington Health Plan Finder portal to apply for coverage. We work closely with the Washington Health Benefit Exchange because both entities share this Washington Health Plan Finder web portal. It's a streamlined application for healthcare coverage through the Washington Health Plan Finder. So these Apple Health programs, we refer them as MAGI-based medical program. MAGI, M-A-G-I, stands for Modified Adjusted Gross Income. This is the methodology that income counted is to determine eligibility. Next slide. So individuals who are single adults, children, parent takers, or pregnant would want to go through the Washington Health Plan Finder so that you can do this online and get real-time results. You can also call and they can do your application on the phone. They also have an app that you can download and use it that way. If you want to fill out an application, a paper application, you can do that and fax it or mail it at the address listed here. So the eligibility criteria varies for each program and is based on household size and income and not resources. Next slide. So staff at the Department of Social and Health Services, so DSHS, they determine eligibility for the Apple Health programs for the classic medical programs. So individuals who are aged starting at 65 or are blind or disabled or needing long-term care would apply online through their Washington Connection web portal. And then their address is listed here as well as their fax. If you click on the link for in-person, that's where the local offices are listed throughout the state. But of course, with the whole COVID-19 pandemic, they are not doing in-person interviews. Everything is being done right now on the phone. Their eligibility criteria varies again for each program, and it's based on household size, income, and resources. Next slide. When applying for Apple Health, and if eligible, eligibility starts the month of application. But if you find that you need eligibility to start prior to the month of application, we can consider eligibility as far back as 3 months prior to your initial submission of application, which we call a retroactive request for Apple Health. So an example of that would be if an individual applies in March of 2019, but they need services prior to that, we can go as far back as the month prior, February, January 2019, and then the third month of December of 2018. Eligibility for the retroactive healthcare coverage is determined separately from an individual's current certification period. So this may mean an individual is eligible during the retroactive period. Next slide. So retroactive coverage is not automatic. Individuals must meet all eligibility requirements for the months requested. It must be made within the certification period, following the retroactive period, or before the determination of benefits, and any appeal process is final. So a letter will be sent approving or denying coverage, and then provider will update the coverage the day after it has been approved. Next slide. So this is a look of the retroactive Apple Health form, the 13952. You can, Healthcare Authority has a process in place to approve somebody for retroactive, and so you can email it, fax it, or mail it to us. Hospitals and Medicaid facilities are required to send this form if they are needing services prior to the initial request for healthcare coverage. Next slide. So for the classic Medicaid programs, those are processed by DSHS. So we would, any request for retroactive medical would need to go to them, because Healthcare Authority would not be doing that process. So we just wanted to make sure that there's a separation, that DSHS retroactive does their own processes. Next slide. So an authorized representative is a person or organization that is authorized by an applicant or recipient to act on their behalf for Apple Health for eligibility purposes. So an ARep can be designated by an individual on the application for healthcare coverage. They can do this on the paper or online. The person or organization that is chosen to be the authorized representative can act on the individual's behalf for Apple Health eligibility purposes. Navigators and volunteer sisters are not automatically considered as an authorized representative. They are partners with the applicant. Next slide. And so now we're going to talk about Medicaid suspension in Provider 1, and I'm going to have Mark. Do you want to take over this?
Sure. Thank you, Melissa. So Medicaid suspension happens in our payment system, which is called Provider 1. And that system tracks the eligibility, and it also determines eligibility for payment for providers when they submit their billing. So in the system, we receive an extract of the jail booking and reporting systems data from the JBERS and DOC each night. So it updates, and because it's public information, so we know who's in and who's out every day in the in incarceration settings. So we don't need to have that information reported to us because we're getting it all the time. Sometimes people with other benefits, cash and food, might have to report to DSHS, but that'd be kind of hard to do if you're incarcerated. So they have other ways of finding those things out and take action on their benefits. But ours are just automatically suspended or not suspended depending on what we get on the interface. Next slide, please. And this is I guess a blurry picture of what a provider sees when they look in the system. And the only important takeaway here is that if it says suspended, then they are suspended. Sometimes there's other things showing in here, either coverage for Medicaid, and it goes by those codes, recipient aid categories, and sometimes it just shows incarceration, but not. Of course, it won't show where, but it just shows that somebody might be incarcerated. The only real takeaway is somebody's suspended only when it says suspended, not any of these other things. So it can be confusing, and we tend to get a fair number of calls, even from providers that aren't quite sure if somebody's, if their coverage is open or not. So when in doubt, go ahead and send an email and ask. Next slide, please. And this is just another slide to show a whole bunch of different statuses on here where it has open coverage, maybe the ABP, but then there's a segment underneath it. This is a DOC offender health program. Then there's a suspension, and then there's a jail rack, the 8500. Everything is kind of tracked by the date. So it's just important to look at the dates. If we want to have coverage with an open-ended end date, and then that means that somebody is covered. Next slide, please. So this is just an example of how the suspension process actually works. So like if Melissa was taken into custody at 6 p.m. on a night, let's say a Friday night, we would actually get that information that evening or the morning at 12 midnight or so when the data is consolidated, and comes over to our system. Our system marks it as either suspended or full coverage, depending on somebody's coming in or going out. And then so if Melissa leaves custody at 5 p.m., we would get that information the next night, and then the system would show that person as released. Typically, though, we never suspend or 1 or 2 day incarceration. A case will never be suspended, but sometimes things happen. We do have discrepancies. Go ahead, next slide, please. Sometimes our system can be out of sync with reality because it doesn't take into account things like electronic home monitoring or work release. Sometimes in work release, people can be eligible. Electronic home monitoring, typically they're eligible for Medicaid because they're not sleeping in a jail facility. So, but our Provider One system can only see a single status. It can only read you're in jail or you're out of jail, or you're in some kind of custody setting, or you're totally out of custody setting. So sometimes the system has discrepancies, and most of the time it's due to electronic home monitoring. But we do have a document that matrix that kind of sorts that out for like when you're eligible for coverage and not in certain settings, and also another document about work release, when you're eligible for coverage and work release and when you're not. And those can be found at that link there. Let's go to the next slide, please. So yeah, if the coding is wrong, this is just a slide that typically that was tell staff what to do, but anytime something doesn't match up, somebody calls and says they were denied payment for a bill, or somebody's looking in the system at eligibility and they can't find it, and anytime our staff get a call like that, they're going to write it up and send it to the system people to call. We don't. We always check out any discrepancy, and because a lot of times it's not only access to care issues, but it's also providers getting paid. So when our staff always write those things up, get them to Provider One staff who call the facilities. So they may get a lot of phone calls. Well, that's why it's trying to have people pay, or for program integrity reasons, to have providers get paid when they're supposed to, and not being paying out Medicaid when we're not supposed to. So next slide, please. Oh, recommendations. Go next. These are recommendations for facility that may be thinking of starting a program on a shoestring or something. These are just ideas, not that they're new or out of the box or anything, but consider a pilot or a small project. Prioritize your most needy populations. Important, connect with your MCOs and BHOs in your local areas, and engage providers and other community agencies or entities that have the same interest in care coordination. And and contact the Medicaid Suspension team at one of our mailboxes if you're having problems kind of pulling that together. Next slide. And these are just more recommendations. Helpful hint to gather information at intake, if possible. Do your Medicaid screening and enrollment at booking if that's possible. And because we always encourage in-facility treatment for SUD, pre-release planning for the seriously mentally ill. Next slide, please. And use of long-acting injectables. Business associate agreements for information sharing. I guess that's probably standard now for all kinds of things. Training individuals how to use their primary care and not rely on emergency services, emergency room for treatment, and teach people how to use their own medications. Assisted outpatient treatment or medication assisted treatment, Matt. One thing to remember is every facility or region or area is probably going to have a slightly different process. So it's just getting to know your partners and learning about how that's going to work in your area. Next slide, please. And so we have a little bit of a extra process. There are a lot of people are in facilities. Maybe they need to have go to SUD residential service. We have a process for that when somebody's in suspense, or maybe they don't have coverage at all. By being taking that course, you can enroll somebody in the system. At least they'll be in there, and their coverage will be suspended. But we can arrange, do a prior auth for SUD, and we have to contact the MCO and request a prior auth. We have this on our suspension webpage, and it's called an honor authorization. And this is actually written up a scenario for people that were recently on that still have their MCO. We can also do this process for new applicants that might not have an MCO assigned. Next slide, please. But the provider can, and they also can coordinate the transportation through our transportation broker, and they just need to know that the person is suspended and what's going on. There's a mailbox, HCA integrated MC questions. I think it's updated now to HCA MC programs, which is Healthcare Authority Managed Care Programs at hca.wa.gov. To help coordinate this process to get prior auths for people that are in the facility and suspended but can't seem to get out because we can't coordinate a bed date. So there is a process for that, and that's this honor auth. But yeah, they can contact the Medicaid suspension box or the MC programs box for help with that process if the other partners don't know what it is. So next slide, please. Resources. Next, yeah. Both the paper applications for Magi and Classic have instructions for how to apply and how to get renew coverage and how to select managed care plans. That third bullet is the area in our webpage where our training and education, where you access the training for this community assister program. So all that information is there. And there's also a directory for area reps such as myself and Melissa that are located throughout the state. So if you ever have a problem with an application or a question about eligibility, that's a place to go. Contacting the person that runs the community or the volunteer assister program, that's her email below at HCA volunteer assister at hca.wa.gov.
Mark, did we just lose you? He warned us that his internet goes in and out.
That's okay. Well, we can go to the next slide. And then this page here is related, is our Medicaid suspension slide in the first bullet. The second bullet is a cross-agency customer support document. It's a really good resource to have. It gives you phone numbers for Healthcare Authority, Provider One, Department of Social and Health Services, the Health Benefit Exchange. So tons of phone numbers to kind of help you navigate who to call if you have issues with, any of the programs. And then the third bullet is a really good video that talks about a facility, I want to say in the Snohomish County, who, went through the whole Medicaid suspension process and how it worked for them. So that's a really good video that we would want you to look at to kind of give you an idea of how it works. And then, of course, if you have any questions for us, our Medicaid suspension at hca.wa.gov email is listed below. And
awesome.
for that,
I think we might have, Mark back now.
I think I'm finally back. I didn't have to sign in, but it finally came back. So yeah, I think the correct mailbox though for the managed care for the honor auth is just MC programs, all one word, at hca.wa.gov. That mailbox keeps evolving as we've moved from integration, part of the state to the whole state. And now I think they just have one mailbox, but whichever one of us gets it, we've shepherded along and facilitated through the whole process. So this is kind of one of the programs that's near and dear to everyone's heart.
So for the last 15 minutes, looks like we have quite a few questions coming in. So I'm going to go back to the beginning, and our friend and buddy, Tony Walton, is asking if you could cover a little bit of what are the red flags on background checks that would prevent you from being a volunteer assister?
Boy, I wish we knew. But you know, if somebody is working in a facility, a county or city facility, like a jail or something, they're probably going to pass. But I have no idea the particulars on that.
No problem, thank you. We do have folks that have raised their hands. I'm going to try and see who all, number of people have raised their hands to ask a question. So I'm going to try. Emily, did you have a question? Emily just disappeared. How about John? John Thompson, did you have a question? I'm going to unmute you if you wanted to. Oh, John, looks like you're self-muted. Okay, how about Maja? Did you have a question? How about Shannon? Shannon, did you have a question? I'm going to unmute you. How about Olga? Did you have a question, Olga? Okay, how about Mandy? There's a lot of folks that have their hands raised. Oh, Mandy, we're getting some feedback. How about Aaron? Aaron, you have your hand raised. Do you have a question? How about Amy? Amy, you have your hand raised. Did you have a question? Amy, we can hear you. Well, Amy typed her question in too, so I'll just let me read her question. Amy's actually asking if the slides will be sent out. And folks, you can download the slides right now on your menu. There's a menu pane that says the handout on your menu. You can actually download the slides that we have right now. So how about for folks that, let's see, let me go back up to the questions and that typed them in. Can individuals be enrolled at any time during incarceration since there's an automatic suspension process? Most of the folks in our local jail are pre-sentenced, and it is very difficult to determine when they will be released. So being able to enroll them at any time versus within a certain time frame of release would be helpful.
Yeah, that can happen at any time because of the interface. So yeah, in fact, always early is always better.
And Mark is asking about the retroactive period. He said the retroactive period cannot include time in jail, correct? And just wanting to make that clear on the retroactive form.
Well, technically it could. I mean, I don't know if, I mean, sure, you can always request it. They may have had an inpatient event then, or maybe even an outpatient or whatever. But if they were in jail that entire month and didn't have a service need, then there wouldn't be much of a point in that. But it could be, you know, a different month. And sure, we are going to look at each month separately. That's how Medicaid is a month-to-month type program.
So better to be safe than sorry and apply and file for the retroactive request.
Yeah, a lot of, you know what you find too often is somebody says, oh yeah, I had a bill, blah, blah, blah. They think it was last month, and we go through all this work, and then we find out it was 2 months ago. Hard to go back and then fix that again. So anyway,
Okay.
if there's a question, just go ahead and go for it.
Andrea types in, is there a reason why a person's pharmacy benefits take longer to be active than their medical benefits? She works with opiate use disorder individuals. When they are released, they need to get their Suboxone right away, but they can't.
Yeah, there's more reasons than I can even go into about that, because they're separate systems and it takes a while from one to tell the other. And yeah, that is something that I know there is another, I believe there's another group kind of piloting something, a local effort on how to kind of do that outside of the system. I know Tony, I think Tony knows more about that, but yeah, that's an issue that's in the background that we're working on.
Tony, is that something that you want to comment on? And I will unmute you. If I can find you. There you are. Tony, is that something you want to comment on?
Yeah, I can comment briefly on that. It is something that's been raised over the course of the past couple of years, at least, that I've been with the Healthcare Authority. And there are a couple of different work groups and ongoing conversations as to how to better facilitate that transition of care for individuals, not only for going into inpatient, but yeah, focus on that pharmacy benefit and ensuring that there's no lapse in the ability to get medication. But I'm glad that Andrea brought it up again within this forum as well.
Great, thank you. And Mike is asking about how often is the SUD residential PA, and I forget what that might stand for.
Prior authorization.
How often is that successful?
Is that a question? Are you talking about the honor auth to get somebody in the SUD treatment?
I think the prior authorization, right? The PA.
Yeah, which is that's what our honor auth is, kind of a PA. For other things, getting a prior auth would be hard, but if somebody was in a facility, but I was multitasking, so I didn't quite hear the question.
Mike, I've unmuted you. Do you want to ask your question directly? Mike, looks like you're on a computer microphone and you may not have, oh, nope. Oh, Mike's dialing in, so we'll come back to Mike.
Yeah, and I want to say it was an issue. It was an ongoing issue, but I want to say the reason for the prior authorization and that whole process was to make it, you know, a little bit more easier to process than it had been before. So, I mean, I want to say it's better than it was before, but it's a constant, you know, work in progress.
Yeah, because it was a catch-22. People couldn't access at all. So this is kind of a bridge, the honor auth anyway, but still imperfect.
Lindsay is asking, so just to clarify, if a person has EHM and are not incarcerated, their benefits are still suspended?
In the system, if we didn't know about that, correct, it would show as suspended. There's, you know, when we know about it, we can do kind of a workaround and make it function properly. But those are the kind of cases I get tickets on all the time and always sending to be fixed. And I have a lot of providers that contact me about that. So someday we'll be able to make that interface smarter, but right now it's not. We can't do it. It's not feasible, and it has to be every reporting system everything would have to be the same. So it's something we're having to work around for a while.
Just to build on the honor auth too, Kelsey saying, I'm glad the honor authorization was included on this. Myself and a few members from my drug court panel went through a long way back and forth process with an honor authorization MCO recently. We actually had contact with you directly, Mark. Thank you so much.
Yay,
Wow.
it worked.
Ever so often.
Yeah. Linda is asking, when individuals have some sort of home monitoring, do they show a suspend? And that can really complicate receiving SUD services. And I think you did talk about that a little bit, that it does show a suspend. Is that right?
Yeah, typically they will. You know, sometimes counties know the drill, like Thurston County, and then they'll send me a list or a couple people that might be on that they know are accessing services, and then we'll go ahead and do our workaround, you know, before a provider tries to bill and gets, you know, rejected. So we just have to know, and we can fix those. If, you know, somebody has ongoing needs and they're going to be accessing their care, we can fix the electronic home monitoring cases.
Jessica says, when working with incarcerated individuals, how does one become an ARep with the individual who's unable to talk with insurance?
Well, you know, on the DSHS application, there's a little spot on the application for somebody to say, oh yeah, I want so and so to be my ARep, and then they kind of sign it or initial it. In the health plan finder, whoever fills out the application has a opportunity to put themselves in as a ARep, which isn't quite following policy, because it's supposed to be something that the individual, the applying individual, you know, the client is requesting, is wanting that person to be an ARep. So, I mean, it's really just client consent. If they say, yeah, I want you to be my ARep, you can be their ARep. It's just not, there's not a good documentation trail always. And it's just for eligibility. It's nothing, you know, it's just for really the numbers. This is my income, this is my resources, this is where I live, blah, blah, blah. Not about, these are my medical conditions, and, you know, we want to talk about that, because that's not what being an ARep is.
And it doesn't, I know a lot of times I've heard people get it confused with being a protective payee, and that's not the same either. It's very different than does not mean that you're going to be their protective payee. It's just you're just helping them, shepherding them through the application process as an ARep.
Exactly, yeah. Typically you'll get a copy of any mail that we send, and yeah, you're just kind of client's right hand, or helping the client.
Andrea asks, does anyone know if there's any additional legislation in the works regarding suspension until after a certain number of days of incarceration?
You know, I don't know in our state what they're doing. There's some states have waivers where they don't consider suspension on the day you go in, that they time limit it. I don't know what ideas are floating around here right now. And there's federal stuff on the to be looked at, but I don't think that'll get any traction at all. And it's the same kind of thing as maybe delaying when the suspension would actually occur, or paying for certain services related to a person's release. But I kind of think with some of that's going to be backburnered now for a while.
Well, it looks like we are out of time for this month's webinar series. Mark and Melissa, thank you both so much for the great information. And if folks have not been able to download the PowerPoint presentation from the GoToWebinar menu, you can shoot me an email at melody, melodie.pazult, PAZOLT @hca.wa.gov, and I'll be happy to send you a copy of the PowerPoint presentation today. Thank you all so much. We are going to take a break from our monthly webinars for the holidays for November and December, and hopefully we'll be coming back after the first of the year with a new series of webinars. If you have ideas for webinar topics that you would like us to address, where there's an interface between the individuals in the legal system And behavioral health, please shoot us that email. We'd love to hear your ideas. And hopefully these webinars have been helpful, and we look forward to hearing from you after the first of the year. So hopefully you'll be joining us in our next series of webinars. Again, Mark, Melissa, thank you so much again for your time today, and thanks everyone for tuning in. So have a great day, everyone.